blah blah blah. Hey all, long time no talk. I was literally sick for like 2 months. I was on 4 rounds of antibiotics and now I'm feeling better and ready to go. I do have a lot to update you on, such as the fact that I am not on Humira anymore. I am on Entyvio and all of that stuff. So I will be making an update video about Entyvio very shortly. I'm sorry for this hiatus. I've been super busy with work and school. So this video is going to be about ways to manage pain. This was a requested video, by the way. So as patients with this invisible disease, we oftentimes deal with excruciating pain, and that is not an exaggeration. With that said, obviously everybody deals with pain differently, but these are just how I deal with the pain when I'm dealing with it. So I have about 5 different ideas here that might help you deal with pain. The first step is attitude. And I know that's not gonna cure your pain right away, but attitude is really, really important when you're dealing with pain. If your attitude is not up to par, your body will not cooperate. You're moping around and complaining to everyone around you. And don't get me wrong, you're allowed to complain. Don't complain 24/7 to everybody you know, because no one will want to help you or feel sorry for you. They'll just think that you're complaining to get attention and that you're a complete loser. First step you need to realize is that you can help yourself. You can do it. You can get through it. You don't necessarily need other people to do it for you. Sure, they can help you, but if your attitude is not up to par, like I just said, you're not going to get any better. You're just going to be moping around and depressed the whole time, and that's not a good thing. So, don't do that. Step 2, comfort. If you're in pain and you're wearing a tight pair of jeans, change into sweats or pajamas or something comfortable. And if you're in pain, don't go run a mile. Lay on your bed and get comfortable. Get super, super, super cozy, okay? If you're in pain, you shouldn't be doing things. You should take it easy. Because if you're busy running around all the time and you're in pain and it's really severe at the moment, it's not going to get any better. So, just saying. Step 3, heating pads or packs of things that you can microwave to get warm, and so you can put it on the area of pain. Here's mine. It has turtles on it, and this thing, I think it has like little beads in it. Not sure. Like herbs, I think, because it smells really good too. And I think I got it from one of those kiosks at the mall. Those annoying, stupid kiosks. This kiosk is worth it, especially if you have an invisible illness or you're in pain frequently. Now, I know the pain is internal, but this is going to help get heat inside your body and help calm things down. I just put this in the microwave for like 1.5 to 2 minutes, and it's warm enough, usually. Actually, last week, I had a gallbladder attack. I almost had to go to the hospital and have my gallbladder removed, but luckily, I put this thing right where it was hurting and it helped, and I was able to get back to sleep and live my life. So these things really do help. If I'm having colitis pain, just put it on the area of pain and it'll help soothe it. Also, heating pads that you plug in are fine too, but I just prefer this because that way I can, hopefully, if it's at night, where most of my pain is at night or in the morning, so I can easily go to sleep with this and not worry about getting electrocuted or it getting way too hot and waking me up later because it'll cool down. Next step is step 4, okay? And tea. I know not everyone likes tea. Some people are strictly coffee drinkers, but sometimes coffee can cause more pain to you. So stick with tea, preferably herbal teas. My holy grail tea for colitis pain is chamomile. I know some people hate chamomile, blah blah blah, but it helps me so much no matter how much in pain I am. I've been in times where I couldn't even move, and I would drink chamomile tea. Well, I could move, but it would hurt. And I would drink chamomile tea and it would just help soothe my insides. I don't know. it works. I mean, other herbal teas are great too, but I think just the warming sensation and the chamomile, the herbs just help a lot. So if you're in pain, drink chamomile tea. I tell you, it helps me. Okay, step 5, last step, medication. Now, personally, I have not been on a pain medication. I've been on medication for colitis, obviously. I've been on steroids, and I've been given nausea medicine that I take as needed. But I have not taken a specific medicine for pain for colitis, so I can't help you. But you know what? If it resorts to medication, it is okay to take medication. There's no shame in taking medication that will help with your pain. In terms of over-the-counter medication, we are not supposed to take Advil, we are not supposed to take Motrin, or any of that stuff. But my doctor, and this might be different for everybody, but my doctor says that I'm allowed to take Aleve. Aleve, I'm pretty sure, according to my doctor, doesn't have the same stuff that Advil has, which is ibuprofen. So Aleve is okay to take if you're having pain. Keep in mind, if you're in big pain and you take a medicine to mask the symptoms, it's not going to necessarily cure you, okay? It's going to mask the pain so that you don't feel it. This can be dangerous if you take too much pain medication, because there could be a serious problem going on that you really do need medical attention for, and you could just be masking it and something really bad could happen. So really be careful. If your gut's telling you that there's really something wrong, more than, you know, just a simple little pain that's going to go away, you should really seek medical attention or call your doctor or a nurse hotline, because I don't want you just to take pain medication and be like, oh, I'm fine, I'll just take it every day. No, don't do that. So that's just my little tidbit on medication. So take everything at your own risk and just be really careful. So question of the day to you commenters down below: have you ever been on a pain medication for colitis, Crohn's, or an invisible illness, or chronic disease, whatever? And if you have, what type, and did it help you? I think this will help people who are looking for medications. My camera is about to die, so that's pretty much the whole video. There's just a lot of ways to deal with pain, and you need to figure out what works for you. So all in all, I will be filming an update video very soon. If you have any requests, please message me on my Facebook account, which I will link down below. I hope you're all doing well, and I'll talk to you in the next video. Bye!